Word on Health, the report with its finger on the pulse of popular medicine with Paul Pennington. Word on Health, for your very best of health.
The annual STI Awareness Initiative aims to place a spotlight on the importance of sexual health, for us to know the facts, to encourage more of us to use protection, be aware of the signs and symptoms of STIs, and, for those of us who are sexually active, to get regularly tested. Nick Dunne is from Brook, the sexual health and wellbeing charity.
The most common STI in the UK is chlamydia, and around 60% of all cases of chlamydia affect young people under the age of 25. We are at the highest gonorrhea rate within the population since 1918 when records began. And syphilis, which some people may have heard of, which is another bacterial infection, kind of died down sort of in the 90s and noughties, but has had a real resurgence in the last couple of years and is at its highest level that we've seen since 1948. And HIV is one that there is a lot of support, treatments and options available around it now. But last year, or should we say 2023, we saw a rise of 51% of new diagnoses of HIV within the population. There's still stigma that people think it only affects LGBT plus people or people of colour, but the rates of HIV rose within the heterosexual community by 30% on the year before.
And Nick, of course, STIs don't just affect younger adults, do they?
We have seen an increase in STIs in the older population, so 50 pluses. A number of reasons for that. The education for those people wasn't around in the same way that it is nowadays. So people may have gone into marriage quite young, have got divorced in their maybe 40s or 50s and started new relationships and haven't got the same education around STIs. Also, because there may not be a pregnancy risk with older people, they think, I don't need to use any protection because STIs are what sort of happens for young people that go around having loads and loads of different partners and having lots of sexual activity. And we've seen sort of in the last 5 years in particular, quite a sharp rise within the sort of 50 plus population. And we're trying to do some targeted health promotion there to say that STIs don't discriminate, can affect you at any age. And yes, there might not be a pregnancy risk, but there is still a risk around STIs that can be long-lasting and life-affecting.
Talking to you off microphone, you mentioned the need for greater health promotion and funding for sexual health services to help address the problems. It's encouraging to see that since 2020, education around sex and relationships is mandatory in secondary schools. For those of us who are older, what can we do as a society to help?
In particular, the stigma and that education around who it can affect. There is still a lot of myths around STIs, and I've been working in sexual health for some 20 years now, and some of them that I was receiving 20 years ago, I'm still hearing now. So the work needs to still be done around challenging some of these. I mean, one of them would be that you need to have multiple partners in order to get an STI, or I've only had sex with, one or two people, so therefore, I'm not at risk. I don't need to get tested until I've had multiple partners. And if you had sex with just one person, unprotected, not using a condom, there's obviously a risk there for an STI. And even with condom usage, it's important to get tested because sometimes condoms split or there's a risk that are associated with fluids exchanging. So it's really good to still get tested even if you are using regular protection. And sadly, there's still a lot of myths around the LGBT plus community, saying that only the LGBT plus community can catch certain STIs, or that people who are having an STI are seen as dirty, and therefore that leads into that stigma of people wanting to come forward to get tested or to seek treatment because they think they'll be judged and seen as dirty. And it needs to be looked at as any other form of healthcare, and normalising that is something that we try and do a lot here at Brook with young people, and just saying it's just part of looking after your well-being. If you're having sexual activity, which a lot of people do, STI testing and treatment is just part of that.
My grateful thanks to Nick Dunne from Brook, the sexual health and wellbeing charity. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Sarcomas are cancers, and there are around 100 different subtypes. Although thankfully rare, data shows they are more common than previously thought, with 15 people diagnosed with a form of sarcoma every day across the UK. Bradley Price is from the charity Sarcoma UK.
Sarcomas are a group of complex cancers that affect the bone and soft tissue in the body. They're not like traditional cancers that you might think of, in that they're not in an organ specifically. They can be anywhere on the body, inside or out, and tend to find themselves in the muscles, bone, tendons, blood vessels and fatty tissues.
Bradley, according to research undertaken by the charity you represent, public awareness of sarcoma is incredibly low. What is it important for us to know?
We're trying to get across to everyone that sarcoma is cancer. We want them to know what it is and how to recognise the signs and symptoms so they can present themselves to their GPs.
So talk me through those symptoms.
The symptoms can be vague, given that it can be anywhere on the body, inside or out, but the most common symptoms are a lump which are bigger than 5 centimetres or are growing. They may or may not be painful, or bone pain. What a lot of patients have said is that the pain persists after they stop doing whatever activity it is they're doing, particularly when you're laying in bed at night. If you find that your bone pain is persisting, then you really should be thinking about going to see your GP.
Are there certain age groups that are more likely to get a form of sarcoma?
For bone sarcomas, which are 1 in 9 sarcomas, particularly Ewing's and osteosarcoma, it's more common in children and young adults, and there is a slight swaying towards it being young boys that get it rather than girls. There will be some gender-specific cancers, like gynecological sarcomas of the uterus. Apart from that, it's like most cancers, the older you get, the more likely you are to get a sarcoma.
What are the risk factors?
We don't really know enough about sarcoma and how it develops to be able to have any specific risk factors. If we can have some more research into this area, I think that we'd be able to find out some more. What we know for certain is that the earlier you're diagnosed, the better the chance that you can have curative treatment. And early diagnosis really is key.
And if we are diagnosed, what level of care and support should be made available to us?
There are a group of specialist sarcoma centres dotted around the UK, and every single patient should be treated or have their care coordinated through one of these specialist sarcoma centres with the very best surgeons, doctors, pathologists, radiologists up to date with the latest research and ideas for sarcoma, and gives them the best possible chance of having curative treatment or living for as long as possible.
My grateful thanks to Bradley Price from Sarcoma UK. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Recent research with a representative sample of the UK population shows that only 5% of us would have great concern if told there was a problem with our liver. This compares to 72% if the same was said of their heart. Yet liver disease is now the biggest cause of death in the 35 to 49 age group and the third biggest cause of premature death overall, having seen a 400% increase in cases since 1970. 47% of people in the recent survey believed most people with liver disease are alcoholics, but that's not true. Dr. Trisha Macnair is a medical journalist and secretary of the Primary Care Society for Gastroenterology.
It is associated with excessive alcohol intake, so that is a factor, but there are many other causes of liver disease.
Trisha, there's been a recent renaming of what was previously termed non-alcoholic fatty liver disease to metabolic associated fatty liver disease. What impact does this newly termed form have on the prevalence of liver disease?
The reason why there's been a 400% increase since 1970 is the association with obesity and being overweight. As you know, as a population, we're getting bigger and bigger, and this puts enormous strain on the liver, taking in all these extra calories that you don't really need coming up from the gut. It stores it as fat, and that fat disrupts the liver. It can cause fibrosis or scarring. It can lead to cirrhosis. The same thing we relate to alcohol, but this is purely from being overweight. And then cirrhosis puts you at risk of liver cancer, and you get all sorts of other complications.
Talk me through the signs and symptoms of liver disease.
And that's another reason why people don't worry as much about liver disease as they should, because in the early stages of damage are really silent. So the liver's struggling away, it's becoming a bit fibrosed, it's becoming a bit fatty, but you don't notice until things are really quite far down the road. In fact, something like 30% of people with significant liver disease don't even realise until they end up in hospital. If we do talk about symptoms, it's usually when the complications start developing. So you may develop varices. These are varicose veins of the esophagus or gullet, and they develop because of back pressures within the liver, causing the veins related to it to swell, and that can cause a bleed. You can then have a vomit of blood, and that might be the first sign that someone gets that their liver is actually in big trouble. There are other more vaguer things. The liver's very important for manufacturing proteins, important in the immune system, so it may just be increased infections, general weakness, general loss of strength. It can be very nebulous.
What about jaundice?
Jaundice is a sign that there's blockages somewhere in the system that drains bile from the liver. That can be a sign of liver disease, but that's really a very end-stage sign. So if you develop jaundice, it's more likely that you've got a common cause of blockage like a gallstone.
Can the liver repair itself?
The liver has a remarkable capacity to regrow, but once a certain degree of damage is done, if it's widespread throughout the liver, and it will be if the cause is fatty liver or if it is alcohol, then you haven't got healthy bits of the liver to regenerate themselves. If you have something like a tumour, you can have that removed from the liver and the rest of the healthy liver around it may regenerate. But once you've got widespread damage, it's much more difficult. But you can slow down or stop the progression of the disease if you get rid of the causative factors.
Initiatives like Dry January have got the message home that those of us that do drink alcohol should reduce our intake, have at least 3-day breaks between drinking sessions and avoid binging. Talking to you off microphone, you were telling me when it comes to avoiding metabolic-associated fatty liver disease, as a population, we really do need to regulate our weight now more than ever.
In the usual way, I'm afraid, healthy diet and regular exercise. Looking at diets like the Mediterranean style of diet, lots of fresh veg, avoiding processed foods, moderation in everything.
My grateful thanks to Dr. Trisha Macnair from the Primary Care Society for Gastroenterology. For further information, visit our website, wordonhealth.com. That's wordonhealth.com.
Keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.